Hey, you over there. Yeah, I see you. You're thinking about starting your own podcast, aren't you? Well, if you haven't heard about Anchor by Spotify, it's the easiest way to make a podcast with everything you need all in one place. Let me explain because I have some experience here. Anchor has tools that allow you to record and edit your podcast right from your phone or computer. When hosting on Anchor, you can distribute your podcast on listening platforms like Spotify, Apple Podcasts, and more. It's everything you need to make a podcast in one place. And best of all, Anchor is totally free. Yeah, that's right. You heard me. Totally free to record, edit, and distribute your podcast. It doesn't get any better than that. So download the Anchor app or go to anchor.fm to get started. Hey everyone, it's episode 10 of Ayana Explains It All, and we are going into Black Maternal Health Week in the United States. And tonight I'm gonna do some cussing and fussing about the state of Black maternal health in this country. And yeah, you guessed it, it sucks. Let's get into it. I've got some explaining to do. Hi, everyone. Hi. Welcome to episode 10 of Ayana Explains It All. Last week, we got into the myth of protecting Black women. And naturally, what flows from that is the myth of protecting and loving the Black mother. Songs about Black motherhood, you see it all on TV. Poetry about it. Everybody is so, Black women are revered, we're magical, we're reverent, we're reverential, we're, held in high regard, high esteem, blah, blah, blah. Well, I'm here to tell you that there is some truth to that, but mostly it's a load of bull. Because even though we may hold Black mothers out to be people who are looked up to, who are admired, who should be revered, who should be respected, society has put us in a bind. And what I mean by that is we're basically clinging to a hope and a prayer that when we get pregnant, we won't die while we're pregnant. Our baby won't die before it's born, or if it's born healthy, that we don't die after we give birth. So there is a crisis, a Black maternal health crisis in the United States of America. It is among the worst in the world, maternal health, in fact. So, as with anything, if it's really bad for everyone, and by I mean all of the women in the country, guess who it is the worst for? Yeah, Black and brown women. But I'm going to cover Black women today. In my episode on Ramadan, I mentioned that I fasted during Ramadan while I was pregnant with my now 17-year-old son because I did not know that I was pregnant. Now, fasting while pregnant is, in my opinion, not necessarily healthy because the baby's getting the nutrients from you, it's siphoning your blood production, it's increasing your heart rate, it's doing all of these things to you, and you're already working on reduced energy, and you get fuel from food. Doesn't matter what you eat or drink, your body's going to get something for it that it can use throughout the day. And so if you're fasting, then your body's not getting it and you're probably going to be sick. Women who are pregnant are excused from fasting. But I didn't know I was pregnant, so I fasted, and I remember feeling just extremely tired all the time. I just wanted to sleep all the time, and I didn't know why. I thought it was just the fasting. but apparently there was something else going on. And at the time, I lived in Ypsilanti, Michigan, and I worked in Toledo, Ohio, which was an hour away. And so I was driving to work for an hour and then driving home for an hour because my then husband, who was now my ex-husband, did not want to live in Toledo. He wanted to live in Michigan. That's where he was from anyway. So this was my first job out of law school, my first associate's job. And I did not have insurance yet. When I first moved to Michigan, I did not have insurance. And so I wasn't really bothering with thinking about birth control or anything of that sort. I knew that I could get pregnant. I had just gotten married. I knew that I could get pregnant, but I wasn't exactly trying to prevent getting pregnant. Um, I wasn't thinking about it. And as with some things, when you don't think about it, it usually just kind of forces you to think about it like, oh, right, I probably should have gotten on birth control. But I was having symptoms for a while, and I finally decided to take a pregnancy test. And lo and behold, yes, positive pregnancy test. But I needed confirmation. I wanted to be sure. I wanted to make sure everything was okay. So I went to Planned Parenthood. Shout out to Planned Parenthood. Hey. They really helped me out. They gave me a pregnancy test. They let me know my due date. I think I still have that note, actually, that the woman gave me at the clinic when she wrote down my due date on it because not that it mattered anyway, because I was so overdue. I was so overdue with my son. So, but that was where I got the confirmation, the medical confirmation that I was pregnant. And so, but it wasn't until December when my insurance kicked in, my commercial insurance, was I able to see a doctor. And so by the time I got to see the doctor, I was already 3 months pregnant. And I could see, I had an ultrasound and I could see my little peanut on the screen. And I was like, wow, okay, I really am actually pregnant. But what the heck does that mean? I was 25 years old and I had no idea what being pregnant was going to do to my body. I had no frame of reference. I wasn't one of those young girls who was really into like babysitting and being around babies and, oh, I want to have a bunch of babies when I get older. I did not want to do that at all. I wanted to work, I wanted to get married, and I wanted to then maybe think about having kids, but it all happened in kind of a wacky way. And I was not married to the most supportive person. In fact, he was very physically and verbally abusive. And so while I was pregnant, I was suffering under that. I was being abused horribly. And so not only was I trying to keep myself alive, I was trying to keep a baby alive, but I was also trying to figure out what I needed to do for my body to make sure that I could continue to carry this baby. And so I would read books and I would go online and I would read all of these things about what's going to happen to your body when you're pregnant. What's the name of that book? What to expect when you're expecting. I had that book and I'm reading and I'm like, gosh, this is a lot of stuff. This is a lot of stuff. A woman's body goes through so much just to, well, number one, to release the egg that's going to get maybe fertilized. We know what happens there. Number two, to carry the fetus, to carry the fetus to full term. Your organs get pushed out of the way. The fetus is growing in the sac and it's sitting right on your bladder. So when you have to go or you're going to pee on yourself. And I experienced that because I was carrying a big baby. Okay. My son, when he was born, was 9 pounds, 10 ounces. Yeah, he was big. So I was dealing with a lot, and there was added stress on me from work as an associate, a first year associate. Getting pregnant as a first year associate is, you might as well just go throw yourself off a cliff because you've done the worst possible thing for your career you could possibly do. It's frowned upon. Like, women time when they want to have kids when they work at law firms because you really want to get in there and get your feet in the door and establish yourself and make sure you have good grounding before you go and, add in changes. But I was pregnant and that was it. And there was nothing that anybody was going to do about it, especially me. I chose to keep my baby, to have my baby, and that was it. So, but it wasn't working out with the law firm. And I got fired when I want to say I was 6 months pregnant when I got fired. And it was a big blow to me. But ultimately, like, I'm sitting here right now telling you, ultimately, it was better for me because I did not belong in that setting. That type of law, I was practicing business law, and it was dealing with contracts and a lot of foreclosures, business foreclosures and bankruptcies, and it just wasn't where I needed to be. Wasn't where I needed to be. I always saw myself as more of a public interest attorney, serving the public. Um, I didn't necessarily see myself as a high powered, that stereotypical high powered attorney, but doing commercial bankruptcies was definitely not where I saw my career. So, them firing me, though it put me in financial ruins, it was better for me in the long run. Alhamdulillah, mashallah. It's what I always say about that. So, when that happened, I got on Medicaid. So, I was on Michigan's Medicaid, and which was great because it covered everything while I was pregnant. It covered the entire all of the doctor's visits, all of the preterm tests and everything, and there were a lot of them. There's that the group B strep test, there's the gestational diabetes test. There were some other blood tests, some genetic testing and things that they were doing. And I'm like, you know what? Whatever you need to do, just do it. I have no idea why I need any of this because first time mother pregnant, I had no idea you could get diabetes when you're pregnant. I had no idea. So yeah, go through all of that. And when my doctor asked me about Lamaze class, do you want to do Lamaze? I was like, I'm thinking, yes, I know what Lamaze is. Yes, let's do that. And my ex-husband was like, no, we don't do that. Meaning Muslims, which is some BS. It's just BS. There's nothing in Islam that says you can't do a Lamaze class. Please. People are so full of crap. Anyway, I'm reminiscing about how much the absolute ignorance and insane changes I went through during this period and the things I had to endure, but mashallah. So I didn't have any birthing class. So, but my son, like I said, he was overdue. I was overdue. I was overdue. He wasn't overdue. He was fine. Um, and when I went in for my final appointment, the doctor was like, okay, well, you're still pregnant and you're not dilated at all. Yeah, I was near my due date and not dilated at all. She said, we're going to schedule you to be induced. And I thought, wow, that's great because at at the time I was having excruciating lower back pain, like pain that was radiating into my legs, which I later learned was sciatica. And there was nothing that I could take for it as a pregnant woman. You can only take like ibuprofen, and that was it. But it's nerve pain, so ibuprofen didn't really do anything. And sitting didn't help, standing didn't help, moving didn't help. It was just one of those, you have to stretch and you have to sit a certain way and you have to lay down a certain way. and you basically have to sit, stand, sit, stand, sit, stand as much as possible. So I was dealing with that. So when the doctor said, "You're gonna be induced," I was like, "Yes, please, because I cannot take this back pain." What I didn't know is that that was not the end of my back pain. Um, so I went into the hospital on Sunday night, and my son was not born until Tuesday morning, the following Tuesday morning. Yeah, I was in labor. I was in active labor from when they put the little thing in me to induce me. That was Sunday night. And then I started active labor probably Monday. I want to say it was Monday when they came and they took the mucus plug out and everything just started advancing and I was having contractions. Let me tell you, contractions, if you've ever had bad menstrual cramps, contractions are one at a time, extremely intense menstrual cramps because your uterus is clamping down on your, I want to say it's your vagina or your cervix, trying to push the baby out, trying to get that baby out. It's the water is gone. It's time to push the baby out. And your uterus is like, yes, get this thing out of here. We want it to be out. So it's clamping down. Every time you have that cramp, it's clamping down. And that's more than anybody ever wanted to know about this. So, but I was in labor, active labor, and nothing was happening. Like I would be, I got to the 10 centimeters, got to the time where they said, yes, it's time for you to push. And I was pushing and pushing and pushing and pushing and pushing, and nothing was happening. He eventually, he was crowning, but I was pulling down on a bar, pushing, and I was bouncing on a ball, and I was on my hands and knees, and I was just pushing and pushing and pushing and pushing, and he would not come out. And my ex-husband was being such a dick. I mean, he was being a real dick. He was like, "You know what? I can't take this. I'm leaving. I'm going home." And so he left and he went home while I was in labor. And my mother was there with me. And the following Tuesday morning, the doctor came in with it's a teaching hospital. So there were doctors and students and nurses, students, and they came in the room and they said, "Well, we met with the panel and we've decided we're going to give you an emergency C-section." And let me just tell you, why while I was pushing, one of the nurses, because I was in so much pain and I had been pushing for so long trying to get this baby out and I was in pain. Yeah, I did have an epidural, but that stuff wears off. And I was in pain and it was wearing off. And the nurse said to me, "Well, you're going to have to be quiet because there are other people here." And I was like, "Yeah, I can hear them." Throughout the night, all I heard was screaming. It's labor and delivery. That's what you're going to hear. Screaming. And I had been in labor and delivery for a long time. So, dealt with that. And then the next day they say, "We're taking pity on you. We're going to give you an emergency C-section." And I'm like, "Crap, what the heck is a C-section? What is this? What is going on?" And, they explained it to me what's going to happen. And so they had to do the numbing below the waist. Now, the numbing below the waist, plus all of the pushing that I was doing, plus all of once the sciatica is aggravated, once that nerve is aggravated, I mean, it's for the rest of your life. Once it's injured, the nerve is injured, I'm doing quotes, it's for the rest of your life. So it was the epidurals, it was the big baby, it was all of the pushing, and then it was the numbing below the waist. I now have sciatic nerve pain for probably the rest of my life. The only thing that has saved me now is I I can't lay down in one position for too long. So I have special pillows and I make sure that my shoes are, have thick soles so I'm not walking on flat surfaces. I make sure that I have good supportive house shoes. I make sure that I have pillows to prop me up because seriously, any unbalanced seat or any hard seat aggravates the sciatica, and I have pain radiating into my legs. And it's really and once it goes away, it's like a soreness that's there. So, in any event, have the C-section. The nurses are trying to find my ex-husband. Can't find him, can't get him on the phone, can't get him on the phone, can't get him on the phone. My mother was in the room. She saw my son being pulled out of me. She says it's an experience she'll never forget. Eh, You'll never forget it. But when they pulled him out, indeed, his head had been stuck. He was stuck in the birth canal. He was stuck in the opening. His head had a giant bruise on it. Poor thing. I had been trying to push, but his head, listen, I love my son, my big-headed baby. He is so beautiful and handsome, mashallah. But he'll be the first one to tell you that the reason he wears his hair the way he wears his hair is to cover up his big head. I love him. I don't care. Big head, little head, cockeyed head. I don't care. But he covers up his head. I wish I could even find the pictures when he was a baby and they took the newborn photos and he has the bruise on his forehead. But eventually, after I had gotten out of the recovery room and back to labor and delivery, dad shows up. But dad continued to act like a dick, and I just decided I was going to leave the hospital with my baby and go back home to Cleveland. I didn't have anything really tying me to Michigan. I was in Michigan for a year, just long enough to get married, get pregnant, have a baby, lose a job, get a job, and I was done. I was gone. And so, but I had a newborn and I had incisions that were stapled up. And because I was fleeing my home, essentially, I was fleeing an abusive home, I didn't have anything with me. So 3 days after I had given birth, I had to go back to Michigan with my stepfather to help clear out my stuff. So yeah, I was moving things and I should not have been moving things. This is something that they tell pregnant women and they tell women who have just had C-sections. Lifting heavy objects, you should not be doing it, especially if you just had a C-section. You could rupture your incision, you could start bleeding. A C-section is major surgery, and after you have major surgery, you're supposed to be laid up, propped up. You're not supposed to be doing anything. So, but I was doing stuff. I was moving and I was trying to deal with uh, a newborn who did not want to nurse. I didn't have any money. I didn't have, so my parents were helping me pay for formula and everything. And they were very supportive, allowing me to stay with them. My siblings, my two sisters were helpful. My sister Nadira was my very first babysitter. And so I had all of that support, but what I needed, because what I was suffering from was postpartum depression. I had that so badly. There were times where I wanted to die. I wanted to kill myself. I was severely depressed and I was not in the best of circumstances. I mean, I had just left my home. I was getting a divorce. I had a newborn baby. I had a C-section that I hadn't planned for. I was back living in in a room in my parents' house, and it was just a lot, and I was very depressed. And there was nobody around to help me deal with that. And so I kind of stayed with my baby, and I tried to get him to nurse. He eventually caught on and he would nurse. And I mean, I nursed that kid for 18 months. And but the circumstances, my depression was leading me. I was sad all the time. I was trying to be the best that I could be because, nobody around you cares that you're depressed. When you have depression, people don't give a shit. And that's a problem. It's especially a problem for a new mother because it puts the mother at risk. Obviously, there's a suicide risk, but there's also a risk that harm could come to the baby. And I know that we have in history, especially recent history, we have cases where women have unfortunately killed their newborn baby because they were suffering from postpartum depression, even postpartum psychosis. And these are things that when you're pregnant, in the throes and the happiness of being pregnant and all of the attention of being pregnant, when the baby is born, the eyes aren't on you anymore. And maybe you don't care, but a lot of women, once that attention is gone, once those hormones that have been up, once they come dropping down, once they aren't getting any sleep because the baby sleeps every 2 hours, and that's 24 hours. The baby is awake, wants to eat, needs to be fed, needs, diaper changed, needs a bath, and you're tired as hell, and you don't have someone who's helping you do this. I didn't have a partner, and my parents worked, and people had their own lives, and so it was just me and this baby. But a lot of women, even if they're married, it's just the woman and the baby because the woman is the mother. We're the ones who are supposed to take care of the baby, right? We're the carriers, we do the feeding, we're supposed to do all of that by ourselves. And so people go on with their lives, and when people talk to you, they want to know how you're doing, how's it going, how's the baby, can we come over and see the baby, you want to see the baby. Everybody wants to see the baby, but nobody wants to like help you out. Nobody wants to give you any relief. Nobody wants to see you. They want to see the baby. And so there are all these factors, but mostly it's the big change of having a baby. Number one, especially if your birth is traumatic like mine was. And number two, having to care for the baby and suddenly you're a parent. Doesn't matter what age you are, that's very scary. It is a very scary thing to suddenly have to be a parent, especially if it's your first time. And so a lot of women develop depression, postpartum depression. And if you're like me, you don't have the income or the insurance. At the time, I didn't have any of that to seek mental health counseling to get medication for it. I probably should have been on medication and I wasn't. I couldn't afford it. Where was I going to get it from? I got an ear infection, I remember, when my son was a couple months old, and I didn't have any insurance. I didn't have any money really. And so I was buying antibiotics from the internet from Canada. And I was just in a very desperate situation. And so I know what it can be like to be poor and pregnant. I know what it can be like to have no insurance and be pregnant, or to only have, like, my son had Medicaid and I had WIC for him, but there was nothing for me. A doctor at a local hospital took pity on me, in fact, in removing the staples from my incision site. So, I mean, I didn't have any money to pay for it, and my aunt drove me to the hospital so that I could have them out because the skin was growing over them. And so I know what it's like to be desperate and depressed and all of these things. And so when people talk about the US Black maternal health crisis, I'm like, yeah, it's been for a long time that things have been this way. This isn't new. It's just that the numbers have gotten worse and it's gotten more attention. You know, the proliferation of social media has given eyes to a lot of things, and people are able to share their stories, and more women are sharing their stories. And collectively, people are going, wow, this is a lot of women who've had to go through this. Maybe we should look at the numbers. And so we're looking at the numbers, and it's like, wow, Black women are going into preterm birth more than white women. Black women are dying more than white women while they're pregnant. Black babies are being born stillborn. Not being born stillborn, obviously, but they're stillborn. Black babies are having complications. The mothers are having complications. There's something to that. So yeah, there's something to that. And April 11th through the 17th is Black Maternal Health Week. And this has been recognized by the Biden administration, by the White House. And so now we have, there's an organization that has helped to bring this to the forefront, the Black Mamas Matter Alliance. What a name. I love it. The Black Mamas Matter Alliance organized Black Maternal Health Week in the United States. Like I said, is April 11th through the 17th of this year. And I believe that's every year. It's April 11th through the 17th. And it aims to amplify the voices of Black mamas, women, families, and stakeholders. Now, the reason we have to do this, the reason why this is needed, is because Black people disproportionately are victims of white racism. Beyond any other group, Black people. And it's not because we're Black, it's they don't like us because we're Black. They treat us differently because we're Black. And this invades every area of our lives. I talked about wages before. I talked about microaggressions, talked about implicit bias. I talked about the myth of protecting Black women in American society. And the U.S. government has gone far in rectifying these wrongs that Black people face because of racism, whether it's systemic or just people spouting off, whether it's people denying you a job because of the color of your skin, or denying you proper wages, or you're being kicked off a plane or a bus, or you're being discriminated against for your hair. I mean, there are all these ways that the U.S. government has had to step in and apply the equal protections of the laws, and it results in Black people getting justice. We're always having to get justice because of the injustices heaped on us. And so here are the numbers. According to the CDC, each year in the U.S., about 700 people die during pregnancy or in the year after. Another 50,000 people each year have unexpected outcomes of labor and delivery with serious short or long-term health consequences. Of those deaths, Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and implicit bias. Social determinants of health prevent many people from racial and ethnic minority groups from having fair opportunities for economic, physical, and emotional health. In 2020, Black women were most disproportionately affected with a mortality rate of 55.3 deaths per 100,000 live births, compared to 19.1 deaths per 100,000 live births and 18.2 deaths per 100,000 live births for white and Hispanic women, respectively. Hmm. Lord have mercy. The U.S. has an infant mortality rate. Excuse. That mortality rate really is just. Whew. Excuse me. The U.S. has an infant mortality rate of 5.6 per 1,000 live births in 2019, with a health disparity among Black babies at a rate of 10.8 deaths per 1,000 live births in 2018. Black women are 3 to 5 times more likely to have a maternal death than white women in the United States. Black mothers are more likely to suffer from perinatal mood and anxiety disorders like postpartum depression in silence and without clinical help. Black mothers are more susceptible to adverse pregnancy outcomes, premature birth, stillbirth, low birth weight, and maternal death. People from some racial and ethnic minority groups are more likely to be uninsured than non Hispanic whites. Research indicates that 22% of Black women receive a lower quality of care than white women and are subject to discrimination in the healthcare field. In 2008, only 6.4% of obstetrician gynecologists practice in rural settings. Perinatal community-based models of care offer enhanced care and support throughout the pre-pregnancy to postpartum spectrum, including doula and midwifery childbirth services to pregnant women who face barriers to care. Mandatory and permanent postpartum Medicaid coverage for 1 year fills a major coverage gap in Black maternal health. Now, the state of Ohio recently expanded its Medicaid postpartum coverage from, I believe it was 60 days to now it is a year. And they were allowed to do so under the American Rescue Plan of 2021. So, despite this reality, Medicaid currently provides, in most states, only 60 days postpartum. The coverage gap is particularly dire for Black communities, especially given that nearly half of births in the United States, that's 43% of the births in the United States, and approximately 2/3 of Black births are covered by Medicaid. 43% of the births in this country are covered by Medicaid. 2/3 of Black births are covered by Medicaid. And Medicaid is some of the absolute worst. It is basic insurance. If you want basic insurance, that's what Medicaid is. There's not all of these extras, these fringe extras. There's not all of these, a bunch of specialists you can go see, and you have, you know, millions of dollars in healthcare dollars that you can spend. And no, there's none of that. you get basic coverage. And if you're an adult, there's no dental, there's no vision. For kids, there is some of that. There's basic vision, basic dental. Like, again, it depends on what state you live in. Medicaid coverage, though it's widely available, each state has its own Medicaid rules. So, like I said, Ohio recently expanded Medicaid to allow for a year of postpartum care from 60 days. But not every state is going to do that, which is a shame. It is an absolute shame because the numbers are there. It's clear. Black women, especially, are dying while giving birth. They're dying while they're carrying babies. The babies are dying. And 2/3 of Black births are Medicaid covered. So you would think that it would be to their advantage, but you would also have to care about poor people. You would also have to care about the livelihood and the health and the safety and the welfare of poor people. But not just poor people, poor Black people. It's not the racism that's always the problem. It's the money that's the problem. They don't want to give the money. Because when you expand services, it costs people money. But here, the federal government is giving states this extra little bump. The American Rescue Plan of 2021, signed into law by Joseph R. Biden. It's there. The opportunity is there. Take it. But really, when giving birth, sometimes it does not matter what your income bracket is, what kind of insurance you have. If it's commercial or Medicaid. When you're Black, you're Black. And the way doctors and nurses are going to treat you is sometimes how they feel about your race. They treat you how they feel about your race. May not have anything to do with you. You could be You could walk into a hospital with a crown on your head, throw money on the table, demand the best doctors, the best specialists, the best care. They're still going to treat you how they feel about people who look like you. And it's because of implicit bias. It's because of stereotypes. It may even be based on experiences they've had with someone. But those personal experiences should not be translating into you discriminating against Black women while you're caring for them while they're pregnant and while they're delivering. The situation is so dire. The situation is so dire. And it has been rising for years, but the personal stories and numbers now are too widespread and publicized. The secret is out. Black mothers are dying in the United States while carrying and delivering and recovering from having a baby. And nearly half of those pregnancies are managed by Medicaid, but Medicaid is only recently exploring implementing community-based innovative models available to women with private insurance. If you have private insurance, like I have commercial insurance through my employer now, um, there's so many options available to you. You can get a personal nurse who can call you and check on you while you're pregnant. And afterwards, you can get a midwife, you have doula services, you could deliver in a birthing center, provided it's in network. But there are all of these options available to you. But they should be available to everyone. But Medicaid is only recently exploring this. And what they're exploring is including doulas and community health workers in their coverage, creating a maternal health care worker to provide home visits during and after the pregnancy, labor support, and advising on a birth plan. So I talked about how I was pregnant for 4 months. That's 40 weeks. Uh, but full term is 39 weeks. Preterm is anything 30 less than 32 weeks. So, staving off preterm health complications becomes important in preventing preterm birth. But of course, when it comes to Black women, where there's smoke, there's fire. If you're living in a low income, underserved neighborhood with a high crime rate and less access to good healthcare options, but also dealing with environmental hazards, the chance for preterm birth and pregnancy complications rise, putting the life of the mother and the baby at risk for injury or death. Adding to it, the demoralizing systemic racism and psychosocial stress, these small fixes to things like Medicaid and commercial insurance, these small little fixes, we'll add coverage here, we'll add money here, da, da, da. It's fine. Do that, yes. But for Black women, for pregnant Black women, Black mothers, what is needed is a social movement. Because as I said, if you're living in a low income, underserved neighborhood, it's probably a food desert with a high crime rate and less access to good healthcare options, but also environmental hazards, systemic racism, psychosocial stress. And I'm not saying this is for all Black women. All Black women are poor and welfare. No. But as I said, how we're treated is the same. We may not be coming from the same background, but how we're treated in the healthcare system is the same because of how people feel about people who look like us. We are not the problem. They are the problem. But people from low income backgrounds are dealing with so much more. I was dealing with a lot too. I mean, at the time that I had a job and I was pregnant, I was making a lot of money, living in a nice neighborhood, but I was dealing with physical and verbal abuse. So there are all of these things that are in our background. And then we go into to be treated by doctors and nurses, and we go to hospitals and we're further demoralized and treated poorly because of how people feel about our race. What is needed is a social movement. Racial and birth justice intersect in the Black community to prevent Black women and children from dying needlessly, from suffering in silence. And this is where we must lend our voices, our focus. This is where we have to go. We're talking about Black Lives Matter. And this is what, let me just say, when we shout Black Lives Matter and white people shout back at us, all lives matter, we know they're lying. And this talk that I'm giving to you proves that they're lying, because Black mothers' lives don't matter. Black babies' lives don't matter here. So when they're shouting back at us, all lives matter, we know that's a lie. And when people are shouting about, be pro-life, don't get an abortion, have your baby, we know that that's for a selfish reason, because when our babies are born, they don't care what happens to our babies. We know they don't care what happens to anybody's babies. They just want the baby. When the baby is born, they don't care about how the baby's being treated in the environment they're living in. They don't care about the environment the child is living in. They don't care about environmental hazards. They don't care about access to food. They don't care about access to health care. They don't care about how the child and the mother are being treated in the healthcare system, transportation, education, economic opportunities, wages. So when you say all lives matter, when you say pro-life, I know you're lying. I know you're full of shit. I, I have seen the numbers. I sat here and I read them. And I've been reading these things to you all about wages and bias. And I know that all lives do not matter here. So before you fix your lips to ever say all lives matter, you better make sure that that is the case. And you can never make sure that is the case because it is not the case. For instance, tennis star Serena Williams related the story of her pregnancy and childbirth that resulted in her having 4 surgeries to clear deadly blood clots. And in her essay, she says how she had to plead with doctors and nurses to listen to her say, I am in pain, I'm dying, something is wrong, please help me. She had a history of blood clots, and this was before she got pregnant. So after she had delivered the baby, after she had a C-section, she knew that something was wrong. When she was in recovery, when she had gone back to her room, she knew that something was wrong. She asked about heparin. Heparin is a blood thinner. She was on a blood thinner. And the nurse said, oh, you don't need that right now. And she said, no, you have to go back on the blood thinner immediately. You can't take it while you're pregnant. You have to go back on it immediately after you give birth. And that's with a lot of medicines. You have to go back on them immediately after you deliver. It's okay. It's safe. It's fine. And she knew that something was wrong. And she's telling the doctors and the nurses something is wrong. And they're basically waving her off. They're denying, you know, we're patients. We know our bodies. But for some reason, medical professionals think that we don't know when something is wrong, that we're just exaggerating. This happens all the time. Major disorders are misdiagnosed or not diagnosed at all. We're dismissed. A lot of times, especially women, we're told to lose weight to feel better. We're told to lose weight. We're just fat. That's the reason why we're feeling tired, run down, why our hair is falling out, why we're having memory problems. We probably don't sleep well at night because we're fat. No, we know when something is wrong. Weight, whatever. You could be skinny, you could be fat and still feel poorly. What do you tell someone who's of the appropriate weight? You probably send them for all the tests they could possibly afford. You don't tell them to lose weight. Anyway, so Serena Williams said that she complained to the nurse, something is wrong, something does not feel right, please do something, I'm dying. And eventually, they listened to her. She had I believe a CT scan, and they discovered the blood clots. But she had had 4 surgeries. 4 surgeries after she had had her baby. She wasn't even able to bond with her baby because she was recovering from all of this. But she had to save her own life. She had to be her own advocate. She had to advocate for herself. And this is something that women, but Black women especially, we have to do in the healthcare system. We have to advocate for ourselves because our complaints are not, we're not being believed. We're not being listened to. We're not being believed. And like Serena said, I had a wonderful doctor. Unfortunately, for a lot of African Americans, they don't have the same experience that I've had because of what I went through. it would be really difficult if I didn't have the health care that I have. And to imagine all the other women that do go through that without the same health care, without the same response, it's upsetting. I think there's a lot of prejudging, absolutely, that definitely goes on, and it needs to be addressed. And she's right. And the prejudging is, of course, the implicit bias, the prejudice, the outward prejudice, but also that inward prejudice that it's that thing that's in your head that makes you not believe the person who is in front of you because of their skin color or their ethnicity or their national origin or their handicap, their disability. You make fun of them or you don't take them seriously. But you're certainly not going to feel sorry for them. You're not going to feel that empathy that's going to make you think, okay, she's in trouble. She's saying she's in trouble. Let me go aid her. But Serena Williams had a wonderful doctor. It was also it was actually the nurses there who were not listening to her when she was saying something was wrong. But her personal doctor was amazing. My personal doctor, when I delivered my daughter, when I was pregnant with my daughter, was amazing too. She was wonderful. She listened to everything, and she had me on the appropriate medication because I had depression and I was dealing with a whole host of other things. And she had me on appropriate medication. She was always, you know, proper checkups, always asking, but also I had my commercial insurance. I had a private nurse who would call me and check on me and do little check-ins, and we would talk. And I had a therapist, and I had whatever services I needed were available to me because I had good insurance. I mean, I have good insurance. I have, I have a nice paying job, good career, but still I'm Black. I mean, none of this changes the fact that I'm Black and people are going to treat me how they want to treat me because I'm Black. But not only am I Black, but I'm a single mother. And so there are all those prejudices that come with that. Where are the kids' moms and where are the kids' dads? Da, 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 da. I remember when my daughter was born and the doctor said, yeah, you just put her by the window and she'll, get darker. And I'm like, why? Why would you say that? Why would you say something like that? First of all, we know when the melanin kicks in, okay? It takes a couple weeks for the melanin to kick in for Black babies. We're not trying to rush. It's going to kick in, number one. Number two, she just a light-skinned kid. I feel like white doctors have never really had too many interactions with light-skinned Black people, especially light-skinned Black babies. When my son was born, he was very light-skinned, and he had nice Black hair, full head of nice Black wavy hair, and the doctor said, "Is his dad Caucasian?" Like, dude, are you serious? Have you never? No, he just light skinned. I mean, and he was a light skinned baby. It wasn't that, the melanin wasn't going to kick in. When it finally kicked in, he was still light skinned. He's just a light skinned kid. Do you not know what light skinned Black babies look like? Gee whiz. And why am I on this tangent? Those stories, man. Oh, good grief. Oh, doctors. Yeah, you could have good doctors. You could have bad doctors. You could have doctors who are just, in and out, couple questions in and out. You could have doctors who don't listen to you. And it's a problem. It's a problem, especially if you're poor, if you're low income, if you're on Medicaid. Doctors are already judging you if you're on Medicaid. They are. They just are. And it is so sad. It is so sad. because when you go in and you have a real problem, they're already trying to get you out of the room because they're not being paid a lot for you to be there. Medicaid isn't paying the bills, okay? In fact, in Ohio, one of the leading pharmacy providers in Ohio doesn't even accept Medicaid. Walgreens. Walgreens does not take Ohio's Medicaid care source. When I found that out, I was like, what? But you're all over the hood. Why are you in the hood if you're not taking these people's insurance? You know? CareSource is one of the leading providers of medical insurance in the state of Ohio. Why are you not accepting this insurance? I'm sure it has something to do with money, and it probably has something to do with racism because everything in this country that is wrong can be traced back to racism. Everything in this country that is what it is can be traced back to systemic racism, slavery. It just can. I mean, I know people don't want to talk about CRT, but it's the truth, man. It's the truth. Anyway, an article published on NBCLX.com explored the path to Black maternal mistreatment and death, including obstetric racism. It says the reason for these racial disparities are complex, but the phenomenon of obstetric racism is well documented. Black women often struggle to get the right diagnosis and have symptoms dismissed. Research also shows they're more likely to give birth prematurely or have an emergency C-section. I had an emergency C-section and a scheduled one. And they are less likely to be treated for pain. My sciatic nerve pain was not taken seriously by my first doctor. The second time around, I didn't have it. But the first time, the first doctor was like, "I'll just take some ibuprofen." Fine. Obstetricians may be dismissive or disrespectful to patients, neglect patients, fail to diagnose pregnancy-related disorders. And what does that look like? Like I said, when you go into a doctor's office and you say, "I think I have so-and-so," and they go, "Oh, well, it sounds like you have a sinus infection. Here are some antibiotics." They're quick to give out the antibiotics, or they're quick to tell you, "Hey, just go home and get some rest. All you need is some rest." You say, "Oh, I think I have all the symptoms of X disorder." And they say, "You just need to lose some weight." Yeah, this happens to pregnant women. They think that people tend to think that pregnant women are worriers, especially that first time mom label people put on women who are pregnant for the first time. They think you're overly cautious about everything. They think you worry too much about this thing or that thing. But we know our bodies. We know when something is wrong. We know when that baby is supposed to be moving and it's not moving, and that means that something is wrong. And not gonna kid you, people would tell me if the baby isn't moving and it should be, drink something sugary to see if it'll get the baby active, to get the baby moving. And it works. But if your baby isn't moving and it's been some hours and it's supposed to be, go to a hospital. Don't listen to the old wives' tales. I've seen so many posts, especially when I was pregnant, so many posts about this thing is happening to me. What should I do? Or this thing, I'm feeling this. What should I do? Because this could this be a symptom of something? Could something be wrong? Because you don't want to be running to the hospital or your doctor every time you feel something is wrong. So you go on the internet and you ask. Back in the day, it was Yahoo Questions, or they had the little chat rooms on the birthing websites and everything, or now it's the Facebook groups and whatever. So there's a little bit of you're worrying too much, but there's also a lot of your body. You know when something doesn't feel right, doesn't seem right. You get it checked out. Get it checked out. Don't second guess yourself. Don't let other people naysay you. Don't let doctors dismiss your concerns. If you are concerned, your concerns should be addressed, period. Doesn't matter what kind of insurance you have. We're talking about two lives if you're pregnant with just one baby. But your risk of death is high when you're pregnant. And for Black women, when you're pregnant, your risk of death is higher than any other woman in this country. And the risk of your baby dying is higher than any other color baby in this country. So, yeah, you need to get that checked out. Advocate for yourself. Please, 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 please advocate for yourself. When a Black woman says, I don't want to get pregnant again because I don't want to die, believe us. I'm a Black mama. Did I think I was going to die? Maybe. The first time I gave birth, I absolutely was scared. I didn't know what was going on. I didn't know what was going to happen to me. I didn't know what was going to happen to my baby. I was scared for my baby. When he was finally extracted from me and I was relieved and I could go home, what was I going home to? I didn't have a job. I didn't have health insurance. From start to finish, my pregnancy with my son was me struggling to get access to medical care and understanding what was happening to me during my pregnancy and my delivery so that I could deliver a healthy child. It did not occur to me that I could get blood clots and die while I was pregnant or while I was in delivery, in active labor. My second time around, the doctors and nurses made sure I had the proper care to prevent blood clots, to prevent gestational diabetes. But the barriers to good care being what they are, even in the setting of commercial health insurance care, if we are not believed when we say something is wrong or does not feel right, it does not matter how much we pay these people to serve us. They are doing us a disservice at the outset because of their bias and prejudgment, their implicit bias, their overt bias, their attitude towards the type of insurance that we have, their attitude towards our marital status, their attitude towards how many babies we've had, their attitude towards our sexual behavior is a problem for them. But even though it's a problem for them, it then becomes a problem for us because of how they treat us based on how they feel about us. So we need to advocate for ourselves. Pregnant women have choices at every step of the pregnancy, including deciding whether to keep the baby, all the way until you're in the birthing room. You can come up with your own birthing plan, how you want it to go. Don't let doctors push you into a C-section, please. A C-section is major surgery. It's not a little thing. And the recovery from it could be dreadful for some women. So if you want to push the baby out, you want to do it without an epidural, you want to do it with an epidural, you want to have a certain kind of music playing in the room, you want your doctor in the room. I mean, you want a particular somebody in the room with you, advocate for that. I know in the times of COVID, you probably can't have whoever you want in the room. It's different. But when I gave birth, you could have people in the room with you. You can only have one person when you're getting the C-section, obviously, but in the labor and delivery, you could have, there were people who came to visit. There were my son came, my sister, my nephews were there. I mean, you come up with a plan for how you want this to go because it is your body that's giving birth, and doesn't matter what's you're keeping the baby, you're giving the baby up for adoption. It doesn't matter. It's still you giving birth. You are in charge of this. You should dictate how it goes. Now, something could go wrong, and sometimes it does, and you have to change your birth plan. Say, for instance, you're giving birth at home and you're running into complications and you have to go to the hospital, then you have to go to the hospital. But at least you start off with a plan which eases your mind. That's really what it's good for. It helps you to calm down about the entire thing. When you have control, as much control as you can possibly have over this, helps you to calm down. It eases your fears a bit. So as much as you can, come up with a plan for how you want to do it. And yeah, something's going to go wrong. Maybe something you may not be prepared for. Your baby's head might get stuck while you're trying to push it out. And you'll have to adjust rapidly, quickly, because, it's your life in the balance, your baby's life in the balance, and you adjust. And then you'll have to get over how your birth plan didn't go the way you wanted it to go. You'll just have to get over it. Once you're out of the pain and you're adjusting and you're bonding with your baby, you'll be fine. But there's a lot of changes you're going to go through. And then after you have the baby, not every woman gets it, but a lot of women do develop postpartum depression. Some women develop depression while they're pregnant. It was a lot to have to deal with. Be in control of your care when you're pregnant. There are barriers to good care, and advocating for yourself when you're in a precarious condition is absolutely necessary, especially as a Black woman. And I know it puts a lot of pressure on you, but the numbers are not on our side. We now know how we are treated when it comes to being pregnant in the United States, when it comes to delivering a baby in the United States. So we have to be prepared. It's just the reality of it. It's sad. It would be nice if we could just relax and just have a baby, but we can't. We can't. That's why this social movement for racial and birthing justice is necessary, because Black women are unable to freely choose to have a baby or not. And if we choose to do so, we are not treated well in the healthcare industry by doctors and nurses and insurance companies and society in general. And we need help. We need help. We need protection, not just from the government. It can't always be the government stepping in to right all of these wrongs. It has to be the people in the communities. It has to be the people in the communities. It has to be nonprofit organizations. It has to be employers. Yeah, let's talk. Let's briefly touch on that. Employers not giving women time off to bond with their babies, not given proper maternity leave. My employer only recently, and this employer has been in business since the 1700s. Only recently has it come up with a maternity leave, uh, a parental leave, I'll say, policy, because men are included in that. And it's also for people who adopt. I mean, there are so many people who need this, who need to bond with their babies. And my employer, you only got time off that you had already earned. So every pay period, you're earning hours. And so when I was pregnant with my daughter, I didn't, I had I had 2 weeks, and I had to use all of my vacation time. I had to use all of my sick time. And then I had to be advanced 6 weeks. And so I had 8 weeks to be with my newborn after recovering from my second C-section. And it took me 2 years to pay back the 6 weeks of time. And that should not be the case. That right there is an injustice. That is an injustice. Now, yeah, that does take the government stepping in, if you catch my drift. That does take them stepping in. There should be a parental leave policy. Every employer should have a parental leave policy. People should not, especially women, should not be having babies and going to work the next day or working while they're in labor. That is ridiculous. That is ridiculous. I don't care how fit you are, how in shape you are. Labor hurts a lot. You should be focused on having your baby, not what the needs of your employer are at that particular time. You should not be thinking about who's going to cover your shift. It should be covered. You should not be thinking about, am I going to have a job when I go back? Because they should be holding that position open for you. You also should not have to quit your job after you give birth. You should not have to, instead of going on maternity leave, well, there's no maternity leave policy, so if you don't show up for work, you're fired. There shouldn't be a a boss calling you while you're recovering from childbirth and asking you about work projects. There should just be support. And this is for all parents who have newborn babies or new children in their homes. They should be given the proper, appropriate amount of time to recover, to adjust, to deal with, again, postpartum depression, to deal with whatever it is they need to deal with. They should be given the appropriate amount of time. Inappropriate, I mean, in some countries, it's 6 months. Some countries, the women get 6 months. In the United States, you're lucky if you get 1 week. Sometimes you're lucky if you get 1 day. And this is a contributing factor to why women sometimes feel stressed when we're pregnant, is because we don't know what's going to happen to our job if we have a baby and have to deal with childcare issues, or, somebody's calling from the daycare or calling from the school, or we're 3 months pregnant, but we really need a job and we don't want our employer to know that we're pregnant. So when we go in for the interview, we try to hide our pregnancies because we know in 6 months we're going to have to take time off for having a baby. It's hell. It is hell. And women should not be made to feel like this. We should not be made to feel as if we're a burden when we're pregnant. If, as you say, America, all lives matter, be pro-life, it should not be hell to be pregnant, to deliver a baby, to have a baby, to raise a child. It should not be hard. If this is what you want us to do, if our lives matter, if our children's lives matter, it should not be hard for us to exist and to live and to be here. And I am tired of it. I am tired of you telling me to my face that everyone is equal, that everything is equal. When I've seen these numbers, I know that is not the case. It may be the case under the law, but in practice, you all are full of shit. In Medicaid, while it is invaluable, it is not accepted everywhere. Not everyone's taking government-supplied insurance. And not only that, people are underinsured in this country. The fear of medical debt, just the fear of it, keeps people from pursuing specialist visits, trips to the ER, multiple trips to see their primary care doctor, hospital stays. When you think about it, a woman, you're pregnant. Can you afford a NICU stay? Can you afford, if you have to have an emergency C-section, can you afford staying? I was in the hospital for 5 days. Can you afford that? There are women who are pregnant right now thinking, how am I going to pay for this? Yes, I have insurance, but they only cover 60%. They only cover 50%, and I have this large copay. Or we have this spin down. We're underinsured. What are we going to do? And if you're on Medicaid, you're thinking, wow, okay, but what's going to happen to me once the baby is born? The baby's still covered, but I'm not covered. It's hell. I can't even, I've been there, so I know how it feels. Even thinking about it right now, I get just a feeling in my stomach of absolute anxiety, anxiousness, rather, because I know how hard it is. I know the anguish. I know the feeling. I know being scared. And I was an adult when I had my babies. I was an adult. I didn't have insurance at one time. I had insurance at one time, but I was alone. I was depressed. I was this, I was that. I was fine. I was good, but I was still unsure. There's so many things to be unsure about. The last thing you need is the threat of death or debt hanging over you. And who is here to reassure you? What is here to reassure you that everything is going to be okay? It was only in 2021 that the masses, the government recognized that there was a problem, a crisis in Black maternal health care that needed to be addressed. And Black women have been living and having babies in this country for hundreds of years. Change is slow. Change is slow, but we're going to make it move faster. We're going to speed this up because we need more Black babies in this country. We need more Black kids. We need Black women to survive. We need Black women to thrive. We need Black children to thrive. We need people to be healthy and safe and secure. We need people to be free of these enormous medical bills that they receive after they've gone for much needed care. Can you imagine? You go to the hospital and your baby is born early. Can you imagine? You go to the hospital, your baby's born early, and there are all these complications, and the baby has to stay in the hospital for months following its birth. That's for some, that's over $1 million. That's anywhere from $500,000 to $1 million. And maybe your insurance will cover it. Maybe you'll only get 80% covered. That's 20% of $1 million. I mean, it's unbelievable. Nobody should have to live with that. Nobody. It shouldn't be that we're scared to get pregnant, that we're scared to get pregnant again, that we're afraid that we have to come up with these plans for what to do because we're Black and pregnant. The world needs to adjust. The world needs to be changed. This country needs to be brought to the 21st century when it comes to Black maternal health care. Health care for moms in other developed nations far surpasses health care in the United States. And maybe it's because they have socialized medicine, or maybe they just give a fuck about their people. Maybe that's what it is. And with that, I will say thank you for riding with me for these 10 episodes. I have tens and tens and tens and tens and tens more to come. So use this time to check out resources in your community that focus on birthing justice, that focus on reproductive justice. Amplify those voices, amplify your own voice. Lend your support to women who are pregnant, to Black women who are pregnant, to new mothers, to established mothers, so that people are not suffering in silence, so that people's needs are met. Wherever you are, there's someone who needs something that you have to offer, whether it's a tweet, a social media post, or a donation. Lend yourself to your community. Don't be closed off. Get to know the people around you. Be a help to the people around you. Thank you. Take care.